Back now to that developing meningitis outbreak connected to steroid injections for back pain. The number of people infected with this rare form of fungal meningitis now has reached 233, and 15 people have died. As you can see, though, no cases here in Colorado.
The outbreak is being traced to the New England Compounding Center. Agents raided it yesterday. The Boston Herald reports the pharmacy apparently was mass-producing tens of thousands of doses in violation of its license.
And Dr. Dianne McCallister, the Chief Medical Officer at Porter Adventist Hospital, is joining us. Thanks so much for being here. This obviously raises questions about safety, and you mentioned you give hundreds of injectable medications every day in your hospital alone. So how, I guess let's just start with the basics, and how do people get meningitis?
So meningitis is a disease where there's inflammation of the lining of the brain and the spinal cord. And so it can happen from bacteria, from fungal infections, as we see here, and then from viruses, but it also can be a chemical irritation.
This outbreak, however, is more unusual than most. I mean, it's surprising to lay people, but also to the medical community. It's really rare.
Yeah, this is really rare. In fact, before this, there were no reported cases of aspergillus, which is the fungus in question causing meningitis. So this completely took the medical community off guard. In addition, as Anna mentioned, we give thousands of doses a day of injectable medications. There's strict processes around it. So it is extremely rare to have people getting ill from an injectable medication.
So how dangerous is it, and how do you go about treating this form of meningitis?
Well, any form of meningitis is very dangerous. The concern here is that because it's never been seen before, there aren't treatment guidelines that are established for it. So since the outbreak started, the CDC and FDA scientists have been working, and physicians across expert physicians creating guidelines for how to treat this kind of meningitis so that people who encounter it can treat it appropriately. Today, however, a new guideline came out because the same drug that's being used for these epidural steroid injections in the back are also used for injections in joints, and there are a couple cases now of this aspergillus in joints, so they came out with guidelines on how to diagnose it and then treat it.
We could talk about this a long time. I mean, there's this whole component of how to treat this disease that comes along very rarely, but also this story, it just sort of underscores how our confidence in the system is undermined. We have to figure out how this medication became infected. Where do we begin to do that?
Well, and absolutely, and since this was first identified, there have been people in the factory trying to figure that out. They have to look at the environment, because fungus grows slowly. Is it in the ceiling, in the walls, on the floor, and how did it get contaminated into the products? Because there are very strict procedures that are used when making any kind of injectable medication. It's done in a hood, it's done with sterile technique. The room is pristine, clean, like an operating room. And so there are a lot of questions about processes and building that need to be answered in order to figure out how this fungus got in these medications.
So we're talking about hundreds of people who are already infected, but we've heard up to 14,000 people may have been exposed. How concerned do we need to be here in Colorado?
Well, so far, when the warning came out, all of us who have healthcare facilities have systems in place that we immediately remove all stock of that medication so it doesn't get used anymore. We've not seen any doses here, but the medical community is vigilant, and we are educating all providers on how to spot this or to consider it in the treatment. I think the risk, given that where it's breaking out, is rather low here because it appears to be more of a East Coast distribution.
We need to run along, but before we let you go, Dr. Dianne, do you have any concerns about whether there's enough regulation for these pharmacies that compound medicines?
I think this definitely opens a question that these compounding pharmacies, are they appropriately regulated? And that will take some, first they'll have to figure out what happened, and then they'll have to figure out if there's any new legislation that needs to occur.
All right, thank you so much, Dr. Dianne McCallister, for coming in today. And you can find out more about this outbreak by visiting thedenverchannel.com. First, click on Lifestyle on our website, then click on Staying Healthy.